If you're following the Lindsay Clancy case, you've probably heard the term psychosis around. Psychosis describes a state where someone's ability to accurately interpret reality can become disrupted. Postpartum psychosis is a rare and very serious psychiatric condition. And then there's the medication-induced psychosis. When I trained in forensics for my MSW, I worked with individuals that were found not criminally responsible. Some of them had experienced this, and they were completely different people when the medication problems became corrected. For this diagnosis, there needs to be evidence that a medication change, or withdrawal actually caused the psychotic symptoms. And simply experiencing psychosis while taking medication does not mean the medication necessarily caused it. Psychosis itself doesn't automatically mean someone isn't criminally responsible. The legal question goes much further into if mental disease or defect caused someone to substantially lose the ability to understand the criminality or wrongfulness of what they are doing, or substantially lose the ability to control their behavior. Someone can potentially perform an action while their brain is profoundly misinterpreting what that action means, or why it's necessary, or what reality they're actually responding to. Think about having an extremely vivid nightmare. And after you wake up, you're experiencing some terror. The brain is responding to something as though it's real, even though it isn't. Psychosis is obviously much more complex than a nightmare. What if there isn't that moment of realizing what reality is? That's why this trial isn't simply about, did Lindsay Clancy do these things? Was psychosis present? And if so, what caused it? And how profoundly did it affect her ability to understand reality and the wrongfulness or control her behavior? They're all separate questions. And that's why this diagnosis matters, but the diagnosis alone doesn't decide the verdict. Psychosis describes what may be happening. Diagnosis tries to understand why, and criminal responsibility asks, what capacity did that person actually have?